Welcome to the CRISP Drug-Related Indicators Dashboard webinar on the Prescription Drug Monitoring Program, also known as the PDMP dashboard. During the general overview of CRISP Drug-Related Indicators Dashboard webinar, we described the process of gaining access to the CRISP Drug-Related Indicators dashboards, recognized and applied the basic features of the dashboards, and identified the technical resources available for the dashboards. Now that we know how to use the dashboards, we will practice interpreting and applying the available data. After today's webinar, you will be able to describe data available in the PDMP dashboard and apply findings from the PDMP dashboard. As a reminder, the PDMP dashboard displays information on Schedule 2 through 5 controlled substances that are dispensed in or into Maryland and reported to the PDMP. The PDMP does not include prescriptions written by providers but never filled by patients. The PDMP receives data from pharmacists or prescribers who can dispense in their office. The PDMP includes most CS dispenses in Maryland. It does not include CS dispensed in hospitals, drug samples to hospice patients by a veterinarian clinic or hospital, and dispensing within an opioid treatment program. The dashboard includes dispenses from January 1, 2016 to present. Data prior to 2016 has been archived. The dashboard displays data based on dispenses measures or individual measures. If you're interested in understanding the amount of controlled substances that are dispensed, I recommend viewing the Dispense Measures tab. If you are interested in understanding how many patients are impacted by CS prescribing, I would recommend viewing the Individual Measures tab. First, select the appropriate measure by choosing either the Dispense or Individual Measures tab. As a reminder, more detailed information is available in the dashboard manual and in the Notes tab on the dashboard. In this slide, we will review the Dispense Measures tab. This includes number of prescription fills, prescription fills per 1,000 population, and refill count. In this slide, we will review the Individual Measures tab. This includes number of individuals receiving drugs, individuals receiving drugs per 1,000 population, overlapping opioid benzo individuals per 1,000. Let's take a quick EPI review. Count is frequency of particular incident condition. It's useful in providing context to a problem. It's also useful when population of interest is difficult to define. Rate standardizes frequency to a common time period and population. This is useful when trying to compare frequencies of disease. It's important to be specific when defining your time period and population. In PDMP dashboard, populations are the entirety of the state or jurisdiction. Both counts and rates are available in the PDMP dashboard, so choose wisely. We are now on the dashboard. For today's webinar, we will demonstrate how to access aggregate PDMP data by running through a potential scenario highlighting the utility of PDMP dashboard. To learn how to use the Tableau features within each dashboard, please watch the General Overview of CRISP Drug-Related Indicators Dashboards webinar. As you may remember from the General Overview of CRISP Drug-Related Indicators Dashboards webinar, the program manages a lot of data and may take a few minutes to load. Here is our scenario. I work for the Howard County Local Health Department as a program manager. I am writing a grant for a new provider outreach and education project with a specific focus on opioid prescribing. I will use the dashboard to describe the need for the project in my jurisdiction and propose potential evaluation metrics. The PDMP dashboard defaults to the Dispense Measures tab, which displays all Schedule 2 through 5 controlled substances prescriptions in or into the state of Maryland. The Individual Measures tab provides aggregate data on unique individuals receiving Schedule 2 through 5 controlled substances. Because the proposed project will focus on improving prescriber behavior in my jurisdiction, I am going to select the PDMP by prescriber option in the Address Type drop-down menu using the Dispense Measures tab. The PDMP by residence option displays controlled substances dispensed based on the residential address of the patient, and the PDMP by pharmacy option displays the controlled dangerous substances dispensed based on the address of the pharmacy. I'm using the PDMP by prescriber option because I'm interested in the number of controlled substances dispensed based on the address of the prescriber. In my grant application, I'm interested in describing trends in opioid prescribing in my jurisdiction in 2019. To do that, I'm going to first press the pause button at the top. The pause button is incredibly helpful to save time as you go through the dashboards. Then I'm going to select the time period January 1, 2019 to December 31, 2019. The next drop-down option is titled Dispense Measure. We want to select number of prescription fills. The state defaults to Maryland, so we don't need to change that option. Then I select Howard County because I only want to display Howard County data. This drop-down is located in the Geography section. In the background portion of my application, I want to describe the number of opioid prescriptions from providers in Howard County, so I will select that measure. Because my intervention is focused on opioid prescribing for pain management, I am going to deselect all, then select opioid non-combination, opioid/stimulant, and opioid/muscle relaxant as my therapeutic classes. I will then select methadone and all other opioid RX as my opioid type. This will exclude buprenorphine prescriptions that are typically dispensed for substance use disorder treatment, which I know from my literature review are not used for opioids for pain management. Now I'm going to hit Resume to assess the data based on the metrics and variables selected. Based on the screen, I see 118,735 opioid pain prescriptions from January 1, 2019 to December 31, 2019 were dispensed in Howard County and written by Howard County prescribers. If I scroll down to the number of opioid prescriptions filled by age group, I can see that adults age 55 to 64 make up the largest group to receive an opioid pain prescription during this time period. Because I am in the middle of drafting my application and would like to pull a few more numbers before writing, I am going to save this screen. To do this, I'm going to hit the print option, then save the PDF. From the PDF, I can use the images in my grant application. PDMP data displayed on the dashboard is preliminary. Data may be subject to changes. In addition to the number of people who received opioid prescriptions from providers in Howard County, I also want to identify the rate of prescriptions. You may remember from the Epi Review slide that the metrics that display a number are helpful to provide the overall total number of people impacted. I also want to provide the rate of prescriptions impacted to provide context to the total number. To identify the rate, let's start with the same time period of the calendar year 2019, since we already have it entered into the dashboard. Now I'm going to select the metric prescriptions per 1,000. This metric represents the number of prescriptions dispensed for every 1,000 individuals. I will keep the therapeutic class and the opioid type the same. Now I'll press resume. The dashboard tells me that for every 1,000 people in Howard County, 376.5 opioid prescriptions are dispensed from Howard County provider during calendar year 2019. I am going to save this data point by printing and saving the PDF again. I also want to compare the 2019 rate to the state. To do this, I'm going to hit pause. Now I'm going to change the county indicated to all counties. I'll leave the rest the same and press resume. The dashboard now indicates that for every 1,000 people, 471.3 opioid pain prescriptions were dispensed from a Maryland provider during the calendar year 2019. By pulling the state and the jurisdiction, I found that Howard County had a lower rate of dispenses than the state overall. Notice the calculation in parentheses. The numerator indicates the number of prescriptions filled in the state. The denominator indicates the number of individuals considered in the rate calculation. The gradient on the bottom left of the map shows a range of the rates by jurisdiction. Lighter blue indicates lower rates and vice versa. If I take my cursor and hover over each jurisdiction, it will give me the rate for each one. It is important to note that these rates are age adjusted, meaning it accounts for the number of individuals represented in each age category. At the bottom of the page, there is important information regarding rate measures. Statewide rate measures are based on geographic regions in which data are presented. If no data are present for a particular geographic region, county, or zip code during the time period selected, the zero value region is excluded from the denominator because data did not exist for that portion of the population. For clarity, both the numerator and the denominator are displayed for all rate measurements. See Notes section for detailed explanation. My provider education will focus on improving opioid prescribing practices, including risky prescribing such as concurrent opioid and benzodiazepine prescription practices. I know from my literature review that patients who are prescribed an opioid and a benzodiazepine at the time are at higher risk of experiencing an opioid-related overdose. My provider outreach project will inform providers about the risk of concurrent opioid benzodiazepine prescribing and tapering techniques. I want my grant application to include the incidence and change over time of benzodiazepine concurrent prescribing. On the PDMP dashboard, switch to Individual Measures tab. I will select the following drop-down options: Address Type Prescriber, Individual Measure Overlapping Opioid Benzo Individuals per 1,000, State Maryland, County Howard County, Therapeutic Class Keep as All, and Opioid Type Keep as All. The overlapping opioid and benzodiazepine metrics reflects the overlapping days supply for an individual patients of benzodiazepine prescriptions and any type of opioid prescription. The metric will not display unless you indicate all therapeutic classes and all opioid types. On the dashboard, I see 20.28 individuals for every 1,000 people in Howard County had overlapping opioid and benzodiazepine prescriptions written by at least one Howard County prescriber in 2019. In other words, 6,394 individuals out of 315,327. I want to compare this number to the state overall, so I hit pause, select all jurisdictions in Maryland. I can see that during the same time period, 17.04 individuals for every 1,000 people in Maryland had overlapping opioid and benzodiazepine prescriptions with at least one prescription written by a Maryland provider. We see that providers in Howard County are prescribing at a higher rate compared to the rest of the state. Now that I have used the dashboard to collect data to include in my grant application, I have saved each finding as a PDF. I am going to write the narrative. I'm going to pull up a sample grant application to include the numbers I pulled from the dashboard into the background section. Feel free to pause and take a screenshot of the sample. As a reminder, the dashboard can be used to collect data to include in your grant application. Make sure that you have saved each finding as a PDF. We showed you a grant sample application, including the numbers pulled from the dashboard into the background section. Feel free to take a screenshot of the example or request a copy. Questions regarding the use of the PDMP dashboard should be sent to mdh.overdosedata@maryland.gov. A user manual is available and will be updated periodically. Remember, all data should be considered preliminary. If you wish to publish reports with this data, ensure it is in line with the signed end user agreement, and please cite appropriately as listed below. Here are a few Dashboard Pro tips. Please take a minute to read through this slide. If you have any questions, please contact the PDMP Informatics Unit at mdh.overdosedata at maryland.gov. Thank you for attending this webinar.